Infectious diseases, huh?
Yep, infectious diseases. This kind of turns into a fire hose full of. Maybe. This kind of turns into a fire hose of multiple different infectious diseases, most of which you guys probably already have an understanding of or an idea of what they are. So a lot of it's going to be review, and then some really long words that no one's going to be able to hear. No one here is going to be able to say. Infectious diseases. This is going to be the spread of bacteria, viruses, other microbes. They are communicable, which means that we can spread them from one person to the other, either through direct contact or through contact through secretions or droplets or things along those lines. When infectious does cause an illness, the time from the exposure to the development of the first symptom is called the incubation period. The interval when the patient is shedding or releasing infectious material is the communicable period when the microbe can be potentially transmitted. So these can overlap. But if everybody remembers COVID, we all kind of got our crash course and all this stuff. You weren't necessarily having symptoms when you're already spreading the illness. So factors causing infection and illness after exposure is virulence. That's how well the microbe is actually able to spread inside your body or cause issues within your body. So the more virulent or virulent, I never know how to say that word. The more it is, the stronger it is. So, I mean, very little virulence is more like Mr. Burns, and a lot is like the Hulk. So the amount of these microbes that are introduced into your body also plays a role in how well the microbe is able to cause issues or an infection. The route, some dosages or some microbes causes severe infection if you breathe them in, but if you swallow them, they, the stomach acids burn them up. So the specific route in which some of these microbes get into your body is significant on how well your body's going to be able to resist these, and then how well someone is able to resist the medications. So some people get sick very easily, some people almost never get sick, and then you have people or patients that are like on chemo. It's gonna be very easy for them to get sick. Sepsis is a life-threatening condition resulting from an abnormal and counterproductive response on the body's part, which causes damage to the tissues and organs. So again, this is another microbe that gets into the body of foreign material, and rather than the body causing an issue with an allergic reaction, the body overreacts in certain other ways and can cause issues with the sepsis. The body overreacts and secretes substances that, instead of helping, hurt the cells, the tissues, and the organs and the blood vessels specifically. Septic shock occurs when the changes result in shock and hypotension that do not respond to intravenous fluids. The pathophysiology involved: you have the local infection in which the microbes multiply. The body mounts a normal immune response, usually including an increase in white blood cells. The body produces lactic acid and other chemicals, and the ability to produce white blood cells may be limited or exhausted. And then septic shock occurs when the lactic acid and other chemicals accumulate within the bloodstream, and then these substances in particular cause the blood vessels to open up and cause, like we saw in anaphylaxis, the leaky capillaries. So again, you have the blood vessels open up, the container opens up, there's not enough blood in there to fill the whole container, blood pressure goes down, but in addition to that, the capillaries or the pipes become leaky, and you start to lose fluid that way as well. So it's kind of a double jeopardy there, if that's the right word. Common causes of sepsis: the lungs, patient acquires pneumonia, It could be hospital-acquired pneumonia or pneumonia acquired out in the community. But this is a very, very common symptom that we'll run into when it comes to responding on, especially the elderly people, elderly population, people in nursing homes. A lot of them become septic through pneumonia. You can also have infections due to a specific abdominal surgery. Pancreatitis can cause sepsis. And then one of the main reasons we see a sepsis or an infection is the GI tract or the urinary catheter or the urological area where we have patients that have UTIs or something along those lines, or a kidney infection that can cause sepsis very easily. The reason these particular places have a lot more potential to cause sepsis versus other infections is because these areas have a very large amount of blood supply going to them, and it's much easier for the infection to get into the bloodstream and things along those lines. Locations of body likely to associate with sepsis are the skin, long-term intravenous catheter, tracheostomy, gastrostomy tube, pressure ulcers. Much about sepsis is still unknown. This is one of the criteria they utilize to help us determine if the patient is septic. In addition to this, it kind of goes over temperature, the heart rate, the respiratory rate, the blood pressure, new onset, altered mental status, things along those lines. In addition to this, we also want to have a potential site of infection. So if you go on a patient, they have a productive cough, they're having difficulty breathing, and it sounds like they have pneumonia, and then they present with these things, this is where we're going to say, okay, their SIR criteria is positive or something like that, or they're most likely septic. If the patient has very strong smelling odor of urine when you stand them up or when you just get there and they have a catheter in and you just have that very distinct smell, you can usually say, okay, yes, this patient's likely septic if they have some of these symptoms. These symptoms are lower or a temperature that is lower than 36 degrees Celsius or higher than 101 degrees Celsius or Fahrenheit. Sorry, I mixed those up. What we have is we have what's called hot, warm sepsis, and then cold sepsis. They can get to the point where their temperature has persisted for so long, and now it's starting to fail, and it's going down. The temperature's going down. So obviously, the cold sepsis is much worse than the hot sepsis. Heart rate over 90, respiratory rate over 20, and systolic blood pressure lower than 90 millimeters per mercury. New onset, altered mental status, or worsening mental status. This is usually the reason we're going to get called. So we'll get called because grandma's not doing as well. She doesn't seem like she's able to get out of bed like she normally does. She isn't making as much sense. She's very lethargic and sleeping all day. And then as we start doing our assessment, we realize the patient has a fever and has a high blood pressure. And then you stand her up to get her to the gurney, you get that odor. You're like, okay, this is most likely sepsis. Quick septic related organ failure assessment. This is just another way that we can assess whether the patient is going septic or not. It does not predict whether someone is septic, but it predicts whether the septic patient will have a longer stay in the ICU or is more likely to die. The reason there's these different criteria is almost like a stroke activation is because a patient that is septic or having an infection can be very vague at first. It's very hard to determine, oh crap, this patient's septic. And when a septic patient starts to deteriorate, they're like a pediatric patient. They deteriorate extremely quickly and fast, and no amount of fluid that you suddenly try to give them as quickly as you can will bring up their blood pressure. And a lot of these patients die, sometimes within the hospital. So I know at Wyoming Medical Center there was this time where they implemented code sepsis. Everybody would run. They would start to try to get as many fluids on board as possible, as quickly as possible, and try to control the sepsis. So it's something that can be hidden for a long time, and then all of a sudden it's there. And when you realize it's there, you're already behind the 8 ball. So there's these criteria to help us try to determine when they are septic. Patient care, we're looking for signs of sepsis in an infected patient. So again, we have a source of infection that we believe this could be a source of infection. And now we're looking for signs that they're actually becoming septic. We're going to provide supportive care. If the patient meets SIRS or any of the other criteria, inform the ED of a sepsis alert. I don't know if I'd go that far. I would say listen, this patient has that smell, has that odor. These are the vital signs. The ER should be able to recognize that right away. And if they don't, when you get there, you can say, hey, I'm concerned this patient's going into sepsis or something along those lines. Okay, selected common communicable diseases. This is the water hose I was talking about, or a fire hose, where we're just going to throw a bunch of communicable diseases at you, and kind of just give a brief history of all these. Patient assessment and care over generalized patient assessment and care for communicable diseases. We want to make sure the patient is going to most likely prevent most of these just through the appropriate vaccinations and standard precautions. This is how we're also going to try to prevent ourselves from acquiring these communicable diseases while we're dealing with these particular patients. And then particular questions, has the patient traveled and has the patient received recommended vaccinations? If you guys worked during COVID or anything along those lines, you understand how well that first question is utilized. Has the patient traveled? Then all of a sudden it wasn't relevant at all, which was kind of silly because everybody was still asking that question. We went to WBI and they would say, have you been out of America during the COVID screen? I was like, well, America is the worst in the world. I think it's worse to be here than anywhere else in America. But care, we're going to understand how the patient feels, wear protective equipment. So a lot of this is just kind of protecting ourselves and then getting further testing or receive preventative prophylactic antibiotics. Chickenpox, caused by the varicella zoster virus. So you'll have to remember that one. I'm just joking. Signs and symptoms starts with vague symptoms resembling a cold, followed by fever, rash, itches, and it's very contagious, person-to-person contact. I didn't know this actually until I was preparing for this, but it can be airborne. The rash from the skin or mucous membranes actually becomes airborne. You can breathe that in. Kind of interesting. And then dried scabs, once they get to that point, do not spread the disease. I think most of us have had chickenpox when we were younger. And treatment was that?
I'm surprised your mom didn't like roll you.
No, they literally at the school would be like, so-and-so's child thinks they have chickenpox. We wouldn't go to school for 2 weeks.
My mom took me over to someone's house.
Yeah, let's get this over with.
Yep. Not too many kids. I mean, after the vaccine, not too many kids have chickenpox.
Yeah, I don't think any of my kids had chickenpox.
My kids.
Yeah.
So they do have the vaccine now. Almost now when they do get chickenpox that's around now is not chickenpox.
Yeah, it's much worse.
Oh, it's much worse now.
Isolation of patients until the lesion is dry, antiviral medications to shorten the course of the disease and prevent complications, and vaccination. Receive vaccine within 3 days of exposure. Measles, also known rubella, highly infectious viral disease. And some of these I'm just going to have to kind of read as we go because, my understanding of these, just because it's not something that we respond on very frequently, is pretty limited, but starts with fever, cough, eye irritation, small blue-white spots inside the cheek or capotlic spots. We're going to see this again. And then red blotchy rash. So we can see that looks much different than the chickenpox. If we run into this and we see a patient with this, we're going to say, yeah, this is different. And consider the fact that it's, any rash like this, we're going to be concerned that it's possibly communicable. And now it's time to get in the hospital, go find out, or get in the ambulance, go find out what we're dealing with. Measles easily spreads through the air through inhaled droplets in the air, contact with nose and throat secretions. There's no specific treatment. The prevention is vaccination, quarantine, and hand hygiene. Mumps, caused by the paramyxovirus. Signs and symptoms starts with vague symptoms such as muscle aches, loss of appetite, headache. progression to swelling and inflammation, one or both of the parotids. Yeah. Which is funny is that, I mean, you can barely see that part, but kind of right here as well. The transmission through droplets, direct contact with saliva. Prevention is vaccination, quarantine of patients for 5 days after the swelling starts. So very likely if we're responding on these things, we're not going to know exactly what we're dealing with unless you happen to remember that one little part and you see that and you're like, oh crap, this is mumps. And throw a mask on them and do what we can. But a lot of these patients that have a lot of the common symptoms of a cold or flu, right? So cold or flu, right? Those two by themselves are infectious and we should already be taking precautions. Hepatitis A. Hepatitis is a general term that means inflammation in the liver. Again, a lot of these signs and symptoms are very vague and very similar at the very beginning where the patient develops fever, nausea, loss of appetite, malaise, abdominal pain, and jaundice a few days later, generally worse in older patients. Here's a picture of jaundice. You'll see it, you'll never forget it. Hepatitis A is spread by fecal and oral route. There's no specific treatment. We can try to prevent it through hand hygiene, proper food preparation, and vaccination. Can we vaccinate against all the hepatitis? Which one can we not vaccinate against? Hepatitis B is infection, very common in many parts of the world. Again, it pretty much starts the exact same way. Nausea, vomiting, loss of appetite, vague abdominal pain, and patient can progress to jaundice. Younger patients may have fewer symptoms, but more likely to start having the chronic or long-term infection. Transmission through blood and any fluid that contains blood, through semen, through cerebral fluid, amniotic fluid, vaginal secretions, and a few other fluids. So just don't touch any of their fluids. There's no specific treatment. The prevention is vaccination, proper decontamination of all equipment after a call. Most of us have our hepatitis B vaccines, and most healthcare professional or healthcare industries require it for you to work at their place. Post-exposure actions: wash exposure site with soap and water, see healthcare provider right away, vaccination, possible immunoglobulin injection, which is not going to be a fun time. Hepatitis C is very similar to hepatitis B in many ways. Signs and symptoms: nausea, vomiting, loss of appetite, vague abdominal pain. This is transmission through blood, through shared needles, and it's less commonly shared or transmitted through sexual intercourse or childbirth. Several safe medication regimens, but no vaccine. So once you get this, you have it for life, and you can't quite prevent yourself from getting it like you can the other two. So standard precautions and proper use of disposal and disposal of sharps. There was a firefighter in Salt Lake when I worked in Salt Lake who had hepatitis that he got from his younger years when he didn't wear gloves and just grabbed a patient and had a sore, and he had hepatitis C from then on. HIV and AIDS. Signs and symptoms for some patients: flu-like symptoms within a few weeks of having the HIV infection, fever, sore throat, and fatigue. AIDS is when it develops to the point where we are no longer able to fight off opportunistic diseases or infections, such as pneumonia, the sarcoma, and tuberculosis. That Kaposi's sarcoma is what I said we'd see later on. It's a particular type of rash right here that you can see, and when it's in the inside of the mouth, it's kind of a white blotchy rash. HIV and AIDS, routes of transmission, shared needles, unprotected sex between men, any penetrative activity involving blood or semen. So, and during delivery or breastfeeding from mother to newborn. These days, there are antiviral medications that reduce and suppress the viral load, which do help people prevent the transmission of disease when they're having sex from one person who has HIV to another person. And it can actually, the less viral HIV amount you have in your body, the less likely it is to start to progress into HIV or into AIDS and get worse. Prevention, standard precautions, public measures to reduce shared needle use and promote condom use. Following significant exposures to blood or any other body fluids, wash the area and consult a healthcare provider. If you do get a random needle poke and the patient does have known HIV, there are things that they can do within the first few days. I think it's that immunoglobulin therapy, where they can actually prevent you from getting the transmission of that disease. It is very expensive though, and I think it's pretty hard on your body, so it would not be just oh, okay, I'm gonna go into the ER after getting this exposure and have this simple treatment done and then go home and continue working. Influenza is common viral illness that we all know about. We know the signs and symptoms of the flu: fever, non-productive cough, severe muscle aches, sore throat, headache, severe weakness. If you've never seen the flu, that's what it looks like. Spread by droplets or direct contact. Antiviral medications such as Theraflu, what is it? Tamiflu can reduce the symptoms, but it needs to be given pretty early. Prevention, hand hygiene, surgical masks, and vaccination. And you have croup. There's something we typically see in younger kids, age 6 to 3 years. Inflammation and swelling of the larynx, trachea, and the bronchi. These kids at this age are the most susceptible and present with an upper respiratory infection that later produces that seal bark cough. And this usually occurs after the kid has gone to bed for a night. They wake up with this exact cough. Transmission by droplets or coughs or sneezes that survive on objects. Assess the child for any patient for shortness, or assess this child or assess someone with croup as you would with any patient with shortness of breath. We want to see how much is affecting their respiratory drive. Prevention, hand hygiene, refrain from touching the nose, eyes, and mouth. If you have children yourself, this is one of those things that if you respond on a kid that has croup, you kind of want to take some measures to make sure you're not taking it home to your kiddo. The whooping cough begins like a typical upper respiratory infection and worsens into fits of uninterrupted coughing, followed by whooping sound on inspiration. That me, everybody? Meet you.
Meeting resolution. How many slides you got left?
Less than 20. Make sure I what?
I don't think your online people want to hear the whole response.
Oh, that'd be fun.
Maybe they do.
I mean, I'd be enjoying that.
Yeah. They might like that.
Entire response from a fire truck.
Okay, pertussis, whooping cough. Bordetella pertussis. It's a bacteria. Same thing. Signs and symptoms. It begins like a typical upper respiratory infection, and it worsens into fits of uninterrupted coughing, followed by a whooping sound on inspiration. What's the matter?
This girl took her dog for a bit.
Oh, we gotta get a report on that.
Yeah.
Just a post-dinner snack.
That's healthy. It's fine.
You read it somewhere on the internet.
Exactly.
Continue, so we can get done with this.
I wonder what kind of dog meds it was for.
We call it the.
Huh?
I wonder what kind of dog
I wonder if
meds
it was like dog pain meds or something,
That's
and
what
she
I
was
was
like, I can just take them.
I got the worst.
My great pain weighs half as much as I do. I take 2. She girl math for that. So you did.
Yeah, she had it with an ice water and a leaf.
All right, you guys, come on, focus. So whooping cough, we don't see it a whole lot anymore. It used to be, especially in the elderly for some reason. Spread by large droplets in the air. It's treated with antibiotics, and it can be prevented with a vaccine. Use hand hygiene and don't touch the nose, eyes, or mouth.
I thought that whooping cough was like crazy.
I feel like at least 3 of these
Right.
so far.
Littles
were
and
ones
elderly
almost eradicating completely until
with
white women
vaccines.
that eat too much oxtails started not vaccinated. It's
Facts.
yeah.
Facts. Pneumonia. He already kind of talked about pneumonia. Fever, chills, shortness of breath. Tachypnea. What does that mean?
Fast respiration.
Pleuritic pain. What does that mean?
Chest pain.
Specifically,
And
inflammation consolidated in part of the lung on X-ray. Not something you're going to see. Potential febrile seizures in the young children and infants.
What's a fever?
Oh, I like that you asked. It is literally a child's body saying, nope, this is too much. So then they have a seizure. And then by doing that, it causes the body to reset in a sense. And it actually bring the fever down. They are super common. You're typically going to see them 6 years and under, mostly in your toddler ages. We get called quite often to a child having a seizure, and it's just they've been sick. You'll get a history of they've had a cough, kind of running a fever. They can't keep control of it, and the body will just be like, reset.
I don't know if this is as like common, but I know my mom, they thought she was they thought she was epileptic, but it turned out that growing up she was just sick all the time, and so she had seizures all the time, but that's how they were really people seizures.
And they typically,
So
if your children have had them, they outgrow it. It's just something that
She have like a weak immune system or something? Why she was sick?
I don't know. She had a lot of things. She also was asthmatic, ran out of that too apparently, and she had a lot of things wrong. Had ADHD really, really bad. Started taking meds and started falling asleep in class, and then got off the meds, and she was fine.
God, I wish I
So-
would have happened.
I don't.
Yeah.
I don't know what was going on in her brain, but
yeah. So your asthma children, your ear infection children. Whoop it.
used to get ear infections all the time. And she had
So,
we finally had to get to. I was like, this is terrifying.
Yeah.
Scared him away.
See, and that's my granddaughter. Same thing. She finally got tubes placed, and she's not quite as sick as she used to be.
No, it's a big ass. Why?
I don't That's what it
Well,
was.
So that's what pneumonia looks like on X-ray.
Well, I got yours. Oh, you got yours all signed up.
Oh, thanks.
Thank you.
So when you look at X-rays, you want to see that darkness that's up around the top part. A friend of mine, had COVID very bad. He was actually, well, he died 3 times on us. He was actually intubated for a little over 90 days. He was in several different hospitals. He was here for a couple weeks and then went on up to Billings and Bozeman, and he was very sick. We honest to God thought we were going to be planning a funeral. He was very sick. And looking at his lungs post-COVID, they're pretty much all white. He has about a dime size where it's darker. It was kind of funny because we were just talking about this tonight. He was told to go and have CT scans done again. And he's going to show us so I can see the difference from what it was to what it is now, just to see. It's been 3 years almost since he's been back. So we'll see. So pneumonia is spread by droplets, but it usually requires close contact in several days. Husband and wife, grandma and grandpa, grandbabies with their grandparents. Vaccinations help. It doesn't prevent pneumonia. It just decreases the symptoms of pneumonia. Same with the flu shot. Hand hygiene and cough etiquette. TB, this is another one we get checked for every year in the healthcare. It's caused by the bacterium Mycobacterium tuberculosis. It's a cough. It's a nasty pain in the butt, dry, persistent cough for no reason. Later on, after it progresses, then you might get a little bit of sputum with it, but not all the time. Fever.
Isn't that what Doc Holiday had?
Sure. Who's Doc Holiday?
That's why he moved to Arizona to Tombstone, was to help your
To me, it just sounds like menopause. Night sweats and weight loss. I mean, a fever, I'd be warm.
So basically what I'm hearing is I want to.
Right. Weight
So we can go
loss?
find
I mean,
somebody.
can it be that bad? It's spread by coughing, singing, or sneezing.
What did you say?
Yep.
Coffee?
Oh, it's spread by sea.
Yes.
I was gonna
So
be
you're
like,
saying
oh.
isn't infectious?
Yeah. It's treated with antibiotics. You can get a vaccine. High index of suspicion. Airborne disease precautions, including N95s. Usually, TB is a lifelong thing. So usually they know they have it and they'll tell you, yes, I have TB. Same with hepatitis. They'll know it. HIV, depending on your patient, they may or may not. We did have a couple of them here in town, and that'd be the first thing they'd say to us when we started to treat them. Meningitis. This one is scary. This one, people are sick. It's inflammation of the meninges. Where are the meninges?
Back here.
Yeah.
Back here, right?
So my daughter was having really bad headaches. She had just started working at the bank. And she thought, she needed the glasses for the computer screen because she's staring at a screen all the time. So then she called her eye doctor because she tried to get the glasses, but her prescription was expired. So she calls her doctor, eye doctor, goes in, and we do the test where they put the stuff in your eye and dilate every time, no matter what. It's $30, no big deal. So she did that, and comparing this test to her previous one, she had severe pressure on the optic nerve. So he suspected intracranial hypertension. When the symptoms progressively were getting worse, her headaches were so severe that they were causing the nausea, the vomiting, the blurred vision, just done with life, just miserable. So she had gone to the ER one night. This one didn't do nothing, so she went to Casper. And they actually wanted to test her, and they did. They did a spinal tap to check her because the symptoms were the same as meningitis. So then we had that scare going around that, well, because her signs and symptoms didn't match either direction 100%. So they tested for both and treated for both, and come to find out it was the intracranial hypertension, which was still bad. But so onset of fever, abrupt, nausea, vomiting, headache, nuchal rigidity. Neck stiffness. It's the key thing, right? So remember, nuchal, neck. There you go. So that's one of the key things with meningitis as far as differentiating the stiff neck. Know it for a test, I bet.
Okay.
Photophobia. Yep. And possible petechiae. They're like little red splotches. You can get them in your eye or on your skin.
You just kind of, oh, you get them. You can see it.
Yeah, you would see if I had petechiae.
It's not like a.
Right. It's not you seeing splotches. See, here's the petechial rash.
Yep.
I think I've only seen the rash once. Spread by direct contact. It is also spread by water fountains. That was one of the things in high school. I remember they were very anal about washing down the fountains because it can be transmitted in there too. Treatment with
your immune system.
right.
Amen.
Treatment with antibiotics and vaccination. Now there's a vaccination. Sexually transmitted infections, STIs, HIV, hepatitis A, B, and C, herpes, HPV, bacterial is chlamydia, gonorrhea, and syphilis. So bacterial, antibiotics, viral, not so much. Prevention, abstinence, condoms, or vaccination. STIs are not a common reason for patients to access 911, so they say. Emergency service except for women who develop PID, pelvic inflammatory disease. It's most commonly caused by gonorrhea or chlamydia, and it causes severe lower abdominal pain that may or may not be associated with increased vaginal discharge. Ticks. In all my years in processing meat, dealing with critters, taxidermy, all of the crap that I do, never had a problem. But Knock on wood. Tick bites can transmit Lyme disease. Most patients will display a rash. Can get, they call it erythema migraines. Within a week that looks like a bullseye. Is there a picture of it in your book?
Yeah.
So it literally looks like a target
Yeah.
with a center spot. Treat it with antibiotics. Prevention in backcountry rescue and wooded areas. So cover your arms and legs. Check yourself frequently for ticks. And remove ticks with tweezers. Huh?
I had one on my belly button once.
Oof.
It was terrifying.
So we process for these two different Wisconsin guys, and one group of guys hunts out on Forgies, out just past the White School on S. The other group of guys hunts just outside of town on Wilsey's Place. It used to be when Forgies group came in, we would cringe because the amount of ticks on those deer out there was phenomenal. Great ticks. I mean, great big ones, and even the little ones. And it was more than one breed of tick. It was crazy. And then Wilsey's group, hardly any.
You wanna see a grown woman run? That would take to my mom.
Oh, I know.
So it says it takes 36 hours for a tick to feed on someone to transmit Lyme.
Probably
So it's gotta be on you
for a while.
for a while before
Hmm.
transmission takes place.
But they typically get into those warm spots that don't see a whole lot of daylight. Armpits, behind your ears. Like me, I would get them up in my hair, just on the backside where the hat, you wear a hat. And that's the only time I wear a hat is during hunting season. Ball sacks.
Do you have
I mean, and initially they get on you. They're on your arm, they're on your leg, they might be on your neck, and then they crawl to where they want to be. You may or may not.
Nice and cozy.
How long was that taking your boat?
Not very long. It was like 3 hours. I got off my cows. So I got chicken cows and I came back in. And I got out of the shower. And I got out of the shower and I was like, there's a weird bump in my belly button, Mom. I think I'm bad.
Also, what is Rocky Mountain spotted fever? It says it's another disease carried by ticks.
Carried by ticks, that's what I was gonna say. Let's see if it gets there. I don't know. I know it's common around here and further north, but we haven't even seen it around here in years. I haven't.
Isn't the tick with the little white spot on him, that's the one supposed to have Lyme disease? Tick with that little white spot doesn't have.
Sounds to me like you could go home.
I was gonna say, I thought any of them could carry it.
It's the difference between the ones with the little white spot on them. And the ones
There's
without.
like different types of ticks.
Yeah. So I know like the grape ticks are huge. They got a huge butt. But I don't know what the other type.
There's like a wood tick. They're red.
Yeah, I'm talking the ones that we have, because you'll see the ones that we have that don't have a white spot, and do have a white spot.
I was like, I should pick up one.
Yeah, I'm curious. I don't know that I've looked close. I don't know that I've looked close enough to see a white spot on. I like to take my scalpel blade and then I play with them. Cut their legs off first and then separate the head from the body.
Symptoms include a severe headache and high fever. Most people develop a rash after symptoms start, and the rash shows up on wrists, arms, and easily and then makes birth. Other symptoms are swelling on the eyes and on the back of the hands.
Okay, we gotta finish this first. In some cases, antibiotics that are used to be effective no longer work. The result of bacteria developing resistance, and patients may get infections that are no longer treatable. Patients may die from diseases that were easily cured a few years ago. The BSI, to protect yourself, your coworkers, and other patients. Recently emerged or newly discovered diseases. No. HIV, SARS, Ebola, MRSA. Nope, ME, Middle East Respiratory Syndrome, and Zika virus. So I said, I don't think so.
It said it was only recognized recently though, in the 20.
It was only recognized back in like the 70s or 80s, right?
It said
Right.
it existed in a corner.
Does that still make it new?
Became-
I mean, it's newer than like measles and mumps and.
Right. So when the next outbreak occurs, unlike our hospital, remain calm. Understand that news reports may exaggerate. What? And follow recommendations of the CDC. Use your better judgment.
There was one that was missing from that list.
Do not follow.
Newly emerging.
I think the book's too old for that.
Oh, probably. So with sepsis, one of the things I was going to touch on too. So my 7 years working at the nursing home, your Alzheimer's and your dementia patients. So they go one way or the other. So you can have the calmest, the normally sweetest dementia or Alzheimer's patient. Once they get a UTI, they are the exact opposite. Guaranteed 100%. So if you get called to the nursing home for a sudden change in behavior or they don't feel good and they report to you that normally this man is just as sweet as pie and he loves to dance and he loves hugs and whatever, but now all of a sudden you look at him funny and he's ready to beat the snot out of you, almost guarantee you it's the UTI. And they do quickly become. It is life-threatening and it is fast. The smell of a UTI turns septic. You'll never forget it. Kind of like the GI bleeds. You just won't. You'll know that smell for the rest of your life. Know the differences between the septic shock, anaphylactic shock, and cardiogenic. Common sources of infection that lead to sepsis include the pulmonary, GI, GU, and the central nervous system. The SIRS criteria, which we don't have that here either. I don't know of many hospitals that do. I don't ever remember calling into Wyoming Medical. I don't know when that started. They are sick people and you suspect of an infection. In the septic patient who does not need resuscitation, the most important thing you can do is notify the receiving hospital of a sepsis alert. When evaluating a patient with a fever or other signs and symptoms suggestive of an infection disease, ask the patient about recent travel. Infectious, sorry. What? You two get this look of guilt, and I'm like, what did I do?
I was trying to get both of these. I wasn't sure who had it.
Number one priority is your BSI. It's the best thing you can do. When new or really newly rediscovered infectious disease outbreaks occur, follow the advice of the Centers for Disease Control and Prevention in their local health department. Determine whether a patient potentially has sepsis using the SIRS criteria and alert to ED. Know what personal protective equipment you need to wear to prevent infection from different infectious diseases. So they had us wearing gowns and astronaut suits and gloves and goggles and
In COVID, during COVID
yes, it was redonkulous.
also.
And I'm a smoker and I have a hard time breathing anyway. I'm gonna get it or I'm not. That was just the way I felt about it. And
That's the only excuse I have, right? That's why I like they have HIV, AIDS, but then I was say they don't have pills. They do that regularly, it's not up to.
I checked the copy of the most recent one.
so what body systems are the most common source of sepsis?
GI.
And
Pulmonary.
lungs. Sorry, I didn't hear lungs. What is the difference between the incubation period and the period in which a disease is transmissible?
2 days. 2 to 3 days.
Good job. Have you had the vaccinations you need to take care of patients without getting sick yourself? So with the hospital,
They didn't make.
Flu shot.
so they don't make us get the flu shot. They ask us nicely, repeatedly. And if you don't, then you have to wear a mask through the flu season. But we were required to have the COVID vaccine.
Really?
I was not required to do it, but the
Absolutely.
country is not technically. not
We were
hospital.
threatened our jobs if we did not.
Oh, I do remember that. Okay. That was too far ago on my brain, but I do remember.
Yes.
When you were with the section.
What is the key word to meningitis?
Meninges.
Men. Damn men.
Stiff neck.
Oh, you said it was a word.
Stiff men.
She said men.
Are we feeling
All of
attacked
you.
right now?
What is the difference between croup and epiglottitis?
Really?
Thank you. Okay,
I'll have to just.
3 stages.
3 stages: infection or local, sepsis or systemic, and then septic shock or systemic with hypotension.
What is this thing?
Systemic and sepsis, same thing.
Okay.
So it's the entire body is now involved. The entire body is trying to fight this infection.
Okay.
Whereas you're just infected, so you've got, what did he do? Hulk and,
I was like Iron Man or something like that.
yeah. So Iron Man is initially the one in there trying to fight it off. And it just keeps getting worse and worse. So now you got the Hulk in there.
Oh.
Is that how he was doing that?
Sure.
Kind of cool, but
Yeah.
infection is usually pretty local, basically. And then sepsis is systemic. It's the entire body fighting it. That's why you're getting the cardiac changes. It's why you're getting the fevers. That's why you're getting, yes, the respiratory rate. Your entire systemic body is trying to fight as long as it can until it can't. And that's
Yeah.
why they say. And
Maybe
the other
then
issue
it's
is
shot,
your,
right?
yep, and your other issue with the elderly especially, the best thing for sepsis is fluid overload, but fluid overload for some of your elderly, your CHF patients, your COPD patients, they already have too much fluid and they're fighting that balance. So now it just gets worse. Ta-da!
So, and not a moment too soon. So,
I'm aware either.
Okay, I stopped it. Hannah, are you still there?
Yeah,
Okay, honey. All done. How you feeling?
okay. Better than I was for sure.
Good.
It was horrible.
What'd you have?
I don't even know. I was down for literally a week and a half.
Yuck. And you went to the clinic?
Yeah,
They test
I
you
went to the
for,
clinic not yesterday, but the day before.
did they test you for anything?
COVID and strep, and it wasn't those. So,
That's all they tested for?
maybe the flu, but they didn't test too much. They just did a swab.
Dumb. All
Yeah,
right, honey. I'll feel better.
I will. I'll see you guys later.
Sounds good. Let us know when you want to take your test.
Okay.
Oh, never mind. I guess you already did.
Yeah, I would think Sunday after work.
Sounds good.
All right.
Okay,
Talk
hon.
to you
Have a
later.
good night. Talk to you later.
Bye.
Up behind Northgate.
all the time.